Amy, I hope you can hear me. I think we're going to wait a minute or two because it looks like we're missing a few people. So hold on. And Amy, since I have you on, I don't know if you can see the React screen with the hands, but wanted to know if you could see the PowerPoint screen that says Employee Wellness Durham County. You could just raise your hand, I guess, or perfect. All right. I struggle with GoToWebinar. I really do. So I'm hoping this time I got it right. Okay, and we'll wait another minute or two and then we'll get started. I know. I have begged them to go back to Zoom, begged them. And apparently, because of the data collecting capabilities of webinar, they use this. But I just don't find it very intuitive and not a great experience for people listening. So, yeah, like if we were on Zoom, we could actually talk. I could talk to you, you could talk to me. I can't really see an opportunity to talk except through sending these messages. So, yep. Sometimes the decisions are beyond our comprehension. So, but anyway, let's get started. So, this webinar, let me make sure my ringer's off. Okay. Alternative therapies for healing the pain. I'm Benita Perkins with Durham County Public Health, and I manage their employee wellness program. And I also have a company, Benny Girl Healthy Lifestyle Branding and Communication. And we focus on healthy lifestyle conversations targeted to women of color to deal with the health disparities that we experience in ways that are under our control to improve our health. So anyway, having said that, I'm going to take myself off camera here, even though I can't see myself, and we're going to get started. Alternative therapies for healing the pain. Pain occurs when something hurts, causing an uncomfortable or unpleasant feeling. The presence of pain often means that something is wrong. Each individual is the best judge of his or her own pain. And just to make sure you guys are seeing the feeling the pain screen, right? It did go to the next screen. You could just raise your hand and I'll see it. Perfect. Okay, great. I've had problems with that. Whole webinars and the screen and the screens never changed. Okay. Sometimes pain has a purpose. It can alert us that we've sprained an ankle, and this pain keeps us from doing further damage. It can alert us to the fact that something is wrong with our body and needs attention, spurring action to minimize injury. For example, pain makes you recoil when you touch a burning hot stove or lets you know you've cut your finger while slicing it. a tomato. So you'll tend to the wound. In severe cases, extreme pain warns you of life-threatening danger, so you'll seek emergency, as in the case of the squeezing pain of a heart attack. But for many people, pain can linger for weeks or even months, causing needless suffering and interfering with quality of life. So there's a difference. You have acute pain versus chronic pain. Acute pain usually comes on suddenly and is caused by something specific. It is sharp in quality and usually doesn't last longer than, say, 12 weeks. It goes away when there is no longer an underlying cause for the pain. Some causes are surgery, broken bones, dental work, burns or cuts, labor and childbirth. Again, after acute pain goes away, a person can go back to life as usual. Chronic pain is ongoing and usually lasts longer than 12 weeks. This type of pain can continue even after the injury or illness that caused it has healed or gone away. Pain signals remain active in the nervous system for weeks, months, or years. Some people suffer chronic pain even when there is no past injury or apparent body damage. Chronic pain is linked to the following conditions: arthritis, cancer, nerve pain like fibromyalgia, back pain, carpal tunnel syndrome, musculoskeletal injuries like back injuries, irritable bowel syndrome, migraine or tension headaches. These are all examples of chronic pain that stick with us. People who have chronic pain can have physical effects that are stressful on the body. These include tense muscles, limited ability to move around, a lack of energy, an appetite change. Emotional effects of chronic pain include depression, anger, anxiety, and fear of re-injury, which might limit a person's ability to return to their regular or leisure activities. An overwhelming number of people use medication to ease chronic pain. In a study of multiple sclerosis patients who experience chronic pain, 45% used medicine to ease their pain. However, in this same study, many of the participants were also engaged in non-medication techniques to ease pain. Today's focus is on techniques to relieve chronic long-term pain without medication. While medication is very helpful, easing pain in the short term, its extended use can have negative side effects. So again, we're focused on chronic pain in this particular webinar. Long-term, life-altering pain. We have opioids, which are one piece of medication that it can be used long-term. Opioids are heavily prescribed for pain medication, but unfortunately, they are also associated with elevated risk of overdose, misuse dependence, or addiction, which can lead to death. Over time, opioids tend to be less effective or require higher doses, especially for dealing with nerve pain. And again, we're looking at different medications for pain that are common. Acetaminophen have the least amount of extended use issues, but may not be as productive in managing pain or other options. In addition, drinking alcohol when taking acetaminophen can cause liver damage. Then we have NSAIDs. And NSAIDs like Aleve or Advil have been linked to ulcers. Long-term use of these medications, not short-term, but long-term use of these medications have been linked to ulcers, stomach bleeding, kidney problems, high blood pressure, and increased risk of heart attacks or strokes. NSAIDs should be avoided if you have high blood pressure, heart disease, or kidney problems, or if you're taking blood thinners. And last, skeletal muscle relaxants. And there are a bunch of different pharmaceutical versions of this. And they were approved years ago for short-term treatments of muscle spasms and back pain, and are used today without good evidence. They're used today without good evidence to treat chronic pain and other conditions. So there's not a lot of evidence. I mean, they're used. I guess they have their moments, but long term, there's just not a lot of evidence that they do the pain relief that they're purported to do. Recommendations generally limit the use of these drugs to a maximum of 3 weeks, since they have not been shown to work for muscle spasms beyond that duration. And they can create dizziness. They can cause dizziness and fatigue that can lead to falls, fractures, vehicle crashes, abuse, dependence, and overdose. Due to these risks, muscle relaxants should be avoided in elderly patients. If your pain has overstayed its welcome, you should know that you have more treatment options today than ever before. Here we've listed a couple of techniques to control and reduce your pain that don't require taking a pill. Some of these treatments will be familiar and straightforward, and others may be new or eye-opening. So let's get started. And here's a tried or true: cold and hot therapy. These two tried and true methods are still the cornerstone of relieving pain for certain kinds of injuries. If a homemade hot or cold pack doesn't do the trick, try asking a physical therapist or chiropractor for their versions of these treatments, which can penetrate deeper into the muscles and tissues. So we all know we get that, I get that workout and I get that spasm in my shoulder, or get some kind of twitch in my back, put a heat pack on, and usually, you're good to go. Exercise. Physical activity plays a crucial role in interrupting the vicious cycle of pain and reduced mobility found in some chronic conditions like arthritis and fibromyalgia. Try gentle aerobic exercises like walking, swimming, or cycling. Physical and occupational therapy. These two specialties can be among your staunchest allies in the fight against pain. Physical therapists guide you through a series of exercises designed to preserve or improve your strength and mobility. Occupational therapists help you learn to perform a range of daily activities in a way that doesn't aggravate your pain. These therapies overlap. A therapist might review your overall medical history and perform various tests and measures to get a sense of any impairments that may be contributing to your pain, including range of motion, posture, strength, balance, and endurance. Chiropractic treatment. This is the most common non-surgical treatment for back pain. For back pain, chiropractors perform spinal manipulation or adjustments to manually restore joint mobility and heal injured tissues through controlled force. A chiropractor may also be helpful to treat neuromuscular skeletal complaints like migraine headaches, fibromyalgia, joint pain, neck pain, certain arm and leg conditions. So they're good for a lot of different types of pain. Serious complications like a stroke, pinched nerve, or worsening herniated disc have rarely been reported. How effective is chiropractic treatment? The American Chiropractic Association, of course, they would provide excerpts and summaries from recent studies that support chiropractic care as an effective treatment for chronic and acute pain, headaches, and neck pain. Approximately 30 million people receive treatment each year, so it appears to help many. Hold on one second. Here we go. Mind-body therapy. Mind-body treatments, there are several to consider, and we'll discuss each one. They help restore a sense of control over the body and turn down the flight or fight response, which can worsen chronic muscle tension and pain. So let's look at cognitive behavior therapy. This therapy is a form. Okay. Let's see, I have a question. Let me just check and see if there's still a question here. Oh, did the slide go forward now? Can you see cognitive behavior therapy? You can raise your hand, yes or no. Okay, good. Cognitive behavior therapy is a form of talk therapy that helps people identify and develop skills to manage negative thoughts and behaviors. For pain management, CBT for short, helps patients change their awareness of pain and develop better coping skills, even if their pain doesn't change. Currently, CBT is the prevailing psychological treatment for individuals with chronic pain conditions like low back pain, headaches, arthritis, facial pain, and fibromyalgia. CBT has also been applied to pain associated with cancer and its treatment as well as anxiety and insomnia. How does cognitive therapy work? CBT focuses on the relationships between thoughts, behaviors, and emotions. Negative beliefs about pain can lead to bad coping, exacerbation of pain, increased suffering, and greater disability. CBT teaches patients effective coping strategies and helps replace negative thought patterns with less harmful thoughts, helping patients increase adaptive behaviors, identifying correct bad thoughts and beliefs, and increase self-efficacy for pain management. Numerous meta-analysis and large randomized studies suggest that CBT for chronic pain has worked. A review of 22 studies found that CBT has a positive effect on pain intensity, pain-related interference, health-related quality of life, and depression. One study, randomized study, a control study, looked at short and long-term effects of CBT for chronic facial pain disorders. And these kinds of disorders, they call them temporomandibular disorder. I've never heard of a TMD, but I guess it's something with your jaws and you're in pain. Can cause severe pain and discomfort that can last for years in the face, jaw, neck, and shoulders. At a 12-month follow-up, CBT patients were 3 times more likely to report no pain interference and twice as likely to report clinically meaningful improved pain relief compared to the control group. So that shows that, it does work. So this is the thing, cognitive here. So it's a view of 22 studies. That's the information there. All right. Guided imagery. I just want to say real quick, I don't know if I said that these techniques include meditation, mindfulness, and breathing. These are mind-body techniques that can help you restore a sense of control over your body and turn down the flight or fight response, which can worsen chronic muscle tension and pain. So anyway, let's go into guided imagery. This goes one step further than CBT, with mindfulness to manage pain using relaxation techniques and visualization of calming mental images to manage acute and chronic pain. So where before with cognitive, you were looking at your awareness of when pain is bothering you um, and looking at the relationship. This is about imagery and imagining yourself, able to remove the pain. How does guided imagery work? When you're under stress, your body's flight or fight mechanism kicks in. Cortisol and other stress hormones can ratchet up inflammation levels in your body, and mind-body practices like guided imagery calm the nervous sympathetic system. While in a state of deep relaxation, you visualize your body as you wish it would be. The process eases stress and lowers cortisol levels, bringing a decrease in pain perception and anxiety that goes with it. How effective is guided imagery? Closing your eyes and imagining your pain away. It may sound like an ineffective method of pain management, but a comprehensive study found evidence that this relaxation and visualization technique can be effective for the management of cancer-related pains, anxiety, nausea, and depression. In a review of 7 controlled studies, guided imagery brought statistically significant improvements to all 287 individuals suffering from arthritis and other rheumatic diseases. That says a lot. 287 individuals all saw improvement after guided imagery sessions with, lower pain perception. Biofeedback. This can help you take more control over normally involuntary nerve pain signals. It's used to help prevent or treat conditions, and it's basically a machine that, as it says, turns data on physiological functions into visual cues. It's used to help prevent or treat conditions including migraine headaches, chronic pain, incontinence, and high blood pressure. This technique involves learning relaxation and breathing exercises with the help of a biofeedback machine, which turns again data on physiological functions into visual cues like a graph, a blinking light, or even an animation. Watching and modifying the visualizations gives you a degree of control over your body's response to pain. During a biofeedback session, electrodes are attached to your skin. Finger sensors can also be used. These electrodes slash sensors send signals to a monitor which displays a sound, flash of light, or image that represents your heart and breathing rate, blood pressure, skin temperature, sweating, and or muscle activity. The idea behind biofeedback is that by harnessing the power of your mind and becoming aware of what's going on inside your body, you can gain more control over your health. When you're under stress, your heart rate speeds up, your muscles tighten, your blood pressure rises, you start to sweat, your breath quickens, and you can see these stress responses as they happen on the monitor, and then get immediate feedback as you try to stop them. Feedback sessions are typically done in a therapist's office, but there are computer programs that connect the biofeedback to your own computer. A biofeedback therapist then helps you practice relaxation techniques, which you can fine-tune to control different body functions. For example, you might use a relaxation technique to turn down the brain waves that activate when you have a headache. Hypnotherapy. Hypnotherapy is an alternative practice where a licensed hypnotherapist guides your mind to a highly focused mental state. How does it work? Hypnosis is used for the treatment of chronic pain and typically involves a hypnotic induction followed by suggestions for comfort and relaxation. Patients are often taught a cue that they can use on their own to enter a state of comfort. How effective is it? A review of 13 studies revealed that hypnosis is significantly effective for chronic pain conditions, including low back pain, arthritis, cancer, and disability-related pain. In some cases, hypnotherapists reduce chronic pain for up to 3 months. In one controlled study, fibromyalgia patients who received hypnotherapy showed significant improvements in pain reduction as well as fatigue and better sleep patterns. Interventional pain management, which is definitely done in a doctor's office under a doctor's care. These procedures utilize minimally invasive procedures like injections, nerve blocks, and stimulators to target the source of chronic or acute pain. These techniques aim to reduce inflammation, interrupt pain signals, and enhance function when conservative treatments fail, often providing long-term relief. The body part targeted could be any part of the body, the neck, the back, shoulders, major joints, or specific nerves. These procedures are generally performed by specialized doctors using imager guidance like X-rays and ultrasound for precision. And these are just some of them. There's the epidural steroid injections. Any of us who have had a baby and had an epidural know about that one. It delivers steroids directly into the space of the spine to reduce inflammation and pain from herniated disc and other spinal issues. Nerve blocks, the injections of anesthetic agents around specific nerves, and they temporarily interrupt pain signals. Radiofrequency ablation. This uses heat from radio waves to temporarily deactivate nerves that are causing pain. Facet joint and medial branch blocks. These target the small points of the spine to diagnose or treat arthritic pain. Spinal cord stimulation. These are implantable devices that send electrical pulses to the spine cord, masking pain signals before they reach the brain. These are effective for chronic pain with about a 50 to 75% success rate in trials. You have joint injections, the cortisone, and that I've probably heard the most about people getting those injections in their knees for knee pain, and they inject a steroid or hyaluronic acid into the joint, and it helps to reduce inflammation. I think those of us who are trying to hold off knee surgery probably have been at least offered that option. And lastly, this intrathecal pump implantation, and it's a device that delivers pain medication directly into the spine fluid, allowing for smaller and more effective doses. It appears to be similar to the joint and medial blocks. So anyway, that's interventional pain management, again, under a doctor's care. But you're not taking a pill. Yoga, Tai Chi, and Pilates. These exercise practices incorporate breath control, meditation, and gentle movements to stretch and strengthen muscles. Many studies have shown that they can help people manage pain caused by headaches, arthritis, lingering injuries. And I can attest to this in my Pilates classes. I've had many students extol the benefits of Pilates as a remedy for lower back pain. And that's because they're focusing on core, which helps to reduce the back's need to do work. So these techniques can be very helpful in mitigating pain. Therapeutic massage. Not just an indulgence. A massage can ease pain by working tension out of muscles and joints, relieving stress and anxiety, and possibly helping to distract you from the pain by introducing a competing sensation that overrides pain signals. Massage aims to reduce pain by increasing healing and disturbing the pain signals sent to the brain. During the massage, the skin and fingers create friction. The friction encourages blood flow to increase. Oxygen and nutrients are carried within the blood flow, and they carry nutrients which are essential for the repair of damaged muscle fibers. Increasing blood flow, therefore, increases the rate of healing, helping to reduce pain. The friction created between the skin and fingers also creates a new sensation. That new sensation is picked up by the receptors within the skin, disturbing the signals sent to the brain. And this means fewer messages are sent to the brain about pain. And so fewer of those messages about pain are sent to the brain because they're being overridden by this other sensation of the fingers and the skin. A new message encouraging relaxation and decreased pain is sent to replace the original message. And so, yeah, give yourself that massage. Go get your massage. It's therapeutic. Touch and Reiki healing. Reiki is a Japanese technique for stress reduction and relaxation that also promotes healing. It is administered by laying on hands and is based on the idea that an unseen life force energy flows through us and is what causes us to be alive. If one's life force energy is low, then we are more likely to get sick or feel stress and pain. And if it is high, we are more capable of being happy and healthy. Therapeutic touch and Reiki healing are thought to help activate the self-healing processes of an individual and therefore reduce pain. Although these energy-based techniques do not require actual physical contact, they do involve close physical proximity between the practitioner and the patient. In the past few years, several reviews have evaluated published studies on the efficacy of these healing approaches to ease pain and anxiety and improve health. Although the few small studies have showed these techniques are beneficial and there are no significant side effects, the limitations of these studies make it difficult to draw definitive conclusions. Further studies need to be done, but you know what? For those who do it and it makes a difference, then that's all that's necessary. If therapeutic touch and Reiki reduce your pain, who cares about the studies? Acupuncture. Although the World Health Organization currently recognizes more than 30 diseases or conditions that can be helped by acupuncture treatment, one of the main uses of acupuncture is for pain relief. 16th century Chinese doctors believed that illness was due to an imbalance of energy in the body. In acupuncture, disposable stainless steel needles are used to stimulate the body's 14 major meridians or energy carrying channels to resist or overcome illness and conditions by correcting these imbalances. Acupuncture is also thought to decrease pain by increasing the release of chemicals that block pain called endorphins. Many acupoints are near nerves, and when stimulated, these nerves cause a dull ache or feeling of fullness in the muscle. The stimulated muscle sends a message to the central nervous system, the brain, and the spinal cord, causing the release of endorphins, which are morphine-like chemicals produced by our own body during the time of pain or stress. Endorphins, along with other neurotransmitters, block the message of pain from being delivered to the brain. And acupuncture may be useful as an accompanying treatment for many pain-related conditions like headaches, low back pain, menstrual cramps, carpal tunnel syndrome, fibromyalgia, etc. Plant-based herbs and spices. Many herbs and spices can treat inflammation and other related conditions. And I'm just going to briefly go over these. White willow bark has been used for centuries to ease inflammation and the cause of most aches and pains. And inflammation is the cause of most aches and pains. The bark of the white willow contains the chemical salicin, which is similar to the ingredients in aspirin. You can buy it as a dried herb and brew it like a tea. It also comes in a liquid supplement or capsule form, but it does have side effects. It can cause stomach upset. If it's used too much, it can slow your kidneys. And just like aspirin, it might promote bleeding if you're on blood thinners. So if you're sensitive to aspirin or if you're taking any over-the-counter anti-inflammatory drugs, like aspirin, you should avoid willow bark. But it does have a history of reducing pain. Turmeric is a spice that gives curry its yellow color and unique flavor. And it contains something called curcumin, an antioxidant that helps protect the body from free radical molecules that can damage cells and tissues. Some people with osteo or with arthritis turn to turmeric as a natural pain reliever because it also helps to relieve the inflammation. And then we have cloves. Whole cloves are often used for cooking. As medicine, cloves can be found in capsule or powder form. Like other herbal supplements, you can use cloves to treat a wide range of conditions. They can help with nausea. They can help treat colds. They may help relieve the pain associated with headaches, toothaches, and inflammation by using them as a herbal supplement. It can also be used as a topical pain reliever. The active ingredient is a natural pain reliever that's used in some over-the-counter pain rubs. Rubbing a tiny amount on your gums can relieve a toothache. But clove oil can increase the risk of abdominal bleeding, so people with bleeding disorders or who are taking blood thinners should avoid clove products. And then we have essential oils and aromatherapy. The U.S. Food and Drug Administration doesn't regulate essential oils. This means essential oil products can vary in purity, strength, and quality across manufacturers. So if you're going to use this, you have to be sure to purchase essential oils from a reputable brand. They can be inhaled or applied topically when mixed with an oil. Never apply undiluted essential oils directly to the skin, and do not swallow them. For most people, the idea of smelling something to make you feel better sounds silly at best. But aromatherapy has been used for pain management since the time of ancient Egyptians. Peppermint oil, lavender oil, chamomile oil, and African miracle oil have all been used for pain management. So you can definitely do more research on which aromatherapies are used for this. But how does it work? According to Psychology Today, aromatherapy positively stimulates the limbic system of the brain to ease chronic pain and anxiety. Is it effective? One surgeon, and I'm just going to say Dr. Oz, studied aromatherapy to expedite recovery time and reduce anxiety in his heart patients. And it was effective because it worked directly on the brain's emotional center. He recommends lavender, chamomile, or eucalyptus oil, or even the scent of green apples to reduce migraines and joint pain. And so we have lavender, we have rose oil. I'm not going to go into all of them, but these are all the different ones to consider. And again, do the research, but it's certainly worth a try. Dietary approaches. Some people believe that changing diet, fat intake, or consuming plant foods that contain anti-inflammatory agents can help ease pain by limiting inflammation. While medication and other treatments are important, many experts say anti-inflammatory diets may help with conditions like arthritis. Changing what's on your plate won't be a magic cure, but an anti-inflammatory diet might lessen the number of flare-ups you have, and it might take your pain down a few notches. Also, an anti-inflammatory diet is widely regarded as a healthy diet, so even if it doesn't help with your condition, it can help you be more healthy. And it's the fruits and vegetables, whole grains, beans, nuts, fish, all the general suspects of healthy diets. Nutritional supplements. There is some evidence indicating that glucosamine sulfate and chondroitin sulfate may be marginally effective for knee arthritis, but other studies have found no benefits at all. This natural compound, it's a natural compound, is well tolerated and safe. And if you use it and it works for you, then that's fine. But studies have shown it doesn't really have a lot of benefit as it's touted to have. Lastly, medical marijuana. This controversial non-opioid alternative for pain is what it is. Spurred on by recommendations from the World Health Organization, the United Nations voted to recognize the medical value of cannabis. More and more states are passing laws allowing medical marijuana use for pain, for headaches, nausea, seizures, and Crohn's disease. Statistics show that the use of cannabis among adults aged 65 and older has increased eightfold in recent years, and as many as 80% of these seniors use it to treat and manage pain. But can it really help? Marijuana contains hundreds of chemical compounds, but THC is a cannabinoid in marijuana that has been most widely researched. THC binds to receptors in the brain to produce effects like reducing pain or anxiety. THC also provides the sensation of being high, which makes this a controversial treatment option. How effective is it? Cannabis has been used for medical purposes for thousands of years, and still there's much that is not known about it. And this information is coming from one of the doctors at Harvard University. So this is one of the studies. But there's much we don't know about it, about how it works and for what conditions. But pain management is an area where both science and personal anecdotes tend to support its use. A study found that medical marijuana had a better safety profile when compared to opioids for long-term chronic pain. So in conclusion, alternative pain methods can be used with traditional medicine or as an alternative to it. However, as with other types of treatments, complementary and alternative medicine doesn't always work for everyone the same way. If you're considering a complementary or alternative medicine, have a conversation with your doctor first. Remember, you may have to try several alternative methods before you find one that works for you. Or perhaps a blend of treatments to figure out which one will work best to alleviate your pain and your symptoms. And that is conclusion. And this is my information, which I will also put in the chat. I'm going to stop sharing my screen. Let's see if I can't get out of this completely. Here we go. Oh. And hopefully you can see me on camera. So, any thoughts, questions, comments? And I'll just pull this over here. Hopefully this was helpful for you. There's a lot of options, as you can tell, from buying something like what am I thinking of? The last one we talked about, buying something like aromatherapy versus going to actually to a doctor and having, machines hooked up to you. But again, not a drug. Have you seen any about transcranial magnetic stimulation? That did not come up in my research at all, Amy. So I don't know about that. These were the things that came up that probably were most, probably have had the most conversation and feedback. But maybe you could tell me, and I wish you, this is what I hate about Zoom, because I would like to know about, what, if this is something you've heard about, what the, what they're saying. Is it science? Where to go for alternative? Where to go for? Oh, okay. Where to go for alternative therapies? Well, I'm going to. This webinar will be up on our channel. Some you don't need a doctor. Some you do. Like hypnotherapy, you're going to have to go to a doctor. Biofeedback, a doctor. Others, being able to do the guided imagery and that kind of stuff. So when I send it, you're going to have to, research who's doing it here. But I would say maybe about half of the therapies we talked about require some kind of specialist to either get you started or, guide you through. So if that helps, you'll be able to maybe do the research once you take a look at the webinar on the channel. And hopefully that helps. I'm just glad to know that you don't have to take a pill. Oops. Let me go back here. Question thread. There we go. I'm going to put it up on our channel. Oh, let me share it. Let me share it with you. Hold on. Oh boy, hold on 1 second. It's going to take me a second to pull it up. And or I can email it to you, but it's our GoToWebinar channel. I should have it ready. I don't know why I don't have this kind of information up and at 'em. And I don't know, because I'm in GoToWebinar, I don't know if it's going to let me go into it. So I have everybody's email. I think I do, because you got an email about this. If you don't mind, I will send you the channel link, because I have to go on. I'd have to get out of this to go into GoToWebinar to see it, and I don't want to lose you guys. So I will do that, but it'll be and then you'll see all the other great webinars that we have. So not just that one. Let's see. I think that's, yeah. So guys, again, thank you so much for coming on. Look out for the follow-up email with the channel. And I'll see you next month if you want to tune in. I don't know what I'll be talking about, but we got stuff going on every week here, so you'll see more stuff. But I'm going to bid you guys adieu, and have a great rest of the day. Bye-bye.